Hey friends, this is Kelly Calabrese, and today I'm here with Dr. Andy Walker. Dr. Andy, thanks so much for being with us.
Sure thing.
We know how busy you are out there on the road, so we really appreciate your time. And you're out there in Anna, Texas with Cold Springs Animal Hospital. Tell us a little bit about what you do out there with your practice.
Well, this is a practice that I joined about a year and a half ago, and we do horses and we also do some dogs and cats. Probably actually more dogs and cats in this practice, but my role is to do about half equine work and half dogs and cats in the clinic.
Excellent. I know you really have specialized in equine. In fact, you won the Large Animal Proficiency Award that you earned, so that's awesome. And you've also practiced extensively in California, Wyoming, Texas. So we really appreciate your expertise. Tell us how you heard about Renovo.
Well, I met Ginger when I was working on her horse, working in a practice over in Pilot Point at that time. And so they introduced me to the product that way. And we actually used it on one of her horses that had become injured.
Okay, excellent. And so since then, can you tell us about a couple of cases that maybe stand out to you that you've used Renovo?
Yeah, we used Renovo in a lot of cases during the initial trial phase because I happened to be with a practice that was participating in that. So I saw it used in a lot of tendon and ligament injuries, places where I had used PRP or, well, mostly PRP in the past, some stem cell, but I tended to use PRP injections in tendon injuries or ligament injuries at that time. And so we started to incorporate Renovo into some of those case treatments and saw very good results. Certainly as good or better than what I had seen with PRP. And it was a simpler process because we could just take the dose of Renovo out, thaw it, and utilize it.
Excellent. I know you're also an expert in lameness. Can you share any cases where you use Renovo for lameness?
Yeah, I mean, we used it on multiple cases. I don't think of any particular ones, but except the ones I was just talking about, where we would have a typical suspensory ligament branch injury, and Renovo, either injected intralesionally or perilesionally around those injuries, would cause a good improvement in fiber quality and appearance on follow-up ultrasound exams. But it would also help, it appeared, to reduce the size and swelling around those lesions quickly, as quickly or better than we had seen in the past with PRP.
Excellent. I know you've also treated a horse with COPD using a nebulizer. Can you tell us what you found there and what made you think to use Renovo in that case?
Well, that was a challenging case because the horse had struggled with COPD for quite some time, and lots of different common therapies had been used. And the owner had a nebulizer, a mask, and a nebulizer that she would use regularly to treat the horse. And just some of the features of Renovo, the signaling proteins that are in there, the anti-inflammatory proteins. I thought that there's a potential that those could signal a reduction in inflammation in the airways if we nebulized it and delivered it that way. So we tried it, and sure enough, the horse clinically did appear better. The rate of breathing decreased. The owner was pretty careful to monitor that, and she was very pleased with the comfort level and the rate of breathing and effort on that horse. It's somewhat subjective, of course. You can't measure that very carefully, but the owner felt the horse had responded. And so we did that treatment, and then we came back about 10 months later and did another one. And actually, we just did the third one. So it's been about 2 years now, where she just picks up the medication and is able to administer it through her nebulizer.
Wow.
So.
Wow, that's exciting. That's fantastic. Thanks for sharing that. What would you say to veterinarians who have not yet used or heard of Renovo?
Well, I think it's a great option for the therapy of or treatment of these tendon and ligament injuries that have plagued us with lameness for years, and it also offers some interesting ways to address inflammation in different ways used creatively, I think.
Okay, excellent. Well, Dr. Walker, we appreciate your time out there at Cold Springs Animal Hospital, and we look forward to catching up with you again in the future.
Thank you very much.
Thank you.